Hi and welcome. I'm trying to learn medicine. Today, ankylosing spondylitis, and after we've done it, we're gonna do something like this. I think I'm right. Neckstretching. And if you participate in the neckstretching, this is what the honors. And here I want to say the neckstretching has nothing to do with the medical part where we're going to talk about ankylosing spondylitis. We would do the neckstretching even if we would be talking about dinosaurs or the Trojan War or something else. So it has nothing to do with neckstretching before we're talking now. And this is no medical advice, we're just reading about it. And we're talking about internal anatomy, and this is no medical advice. So, ankylosing spondylitis. And the neckstretching has nothing to do with it. Ankylosing spondylitis. A disease of the joints, and if you participate in the neckstretching, that's what the honors. Ankylosing spondylitis. A disease of the joints affecting mainly young men in their 20s and 30s. I want to add already at the place that the book is from the 80s. A disease of the joints affecting mainly young men in their 20s and 30s. It usually affects the spine, causing joints to fuse by an unusual process of bone formation. Okay, the bones in the spine, these vertebrae, start to fuse. Symptoms. Onset of symptoms is gradual over a period of months or years. It's actually faster than I thought. But maybe they mean with years, many years. Repeated attacks of backache is in a healthy, fit person aged 20 to 45. That is a symptom. Okay, if a fit person, do they say, aged 20 to 35, has repeated attacks of backache or back pain. That is a symptom of ankylosing spondylitis. Early morning back pain and stiffness. This can radiate down one or both legs. That's interesting. I should talk a bit clearer. So differentiate more. Early morning back pains and stiffness can it have. So the people can have in the morning pain in the back and also a stiffness feeling in the back. And this can radiate down one or both legs. And also increasing stiffness of the whole spine, which may be revealed if the sufferer tries to bend down and touch his toes. Okay, the whole spine gets more stiff, and if a person tries to bend down and bend the spine, it can be noticed then that the spine is more stiff than usual. Tenderness over the hip joints. That is again interesting. Chest expansion may be limited. It would be also interesting. Spinal joints are the main one involved, but in some cases the shoulder, hips and knees may be affected. Okay, it can be also somewhere else, but it's mainly the spine. It can be also in shoulder, hip or knees. Duration. Slowly progressive over many years, so it gets worse over the years. Causes. No definite cause has been isolated, but the condition sometimes runs in families. So no cause found. In the 80s, maybe something was found. Complications. In the long term, regional ileitis, ulcerative colitis, and certain heart defects may develop. Okay, the people can have regional ileitis, I don't know what it is, they can have ulcerative colitis, that is not good, and certain heart defects may develop also. That's also fair. Iritis, that is inflammation of the eye, can occur in 25% of cases. That is interesting. I like to know the cause of reason. It can cause iritis, and that is inflammation of the eye. A quarter is it. Long-term disease can cause the spine to become rigid. I don't know what rigid means. And this in turn leads to kyphosis. And that is curvature of the spine, which with neck distortion can result in a crippling handicap. Okay, the spine can get rigid, whatever it means, and that can lead the spine to become curved. And that can lead to a problem with the neck and where the head is. And that whole can then affect the person who has it. Treatment in the home. None possible except under medical direction. So, visit the doctor, the say. When to consult the doctor, immediately the disease is suspected. Okay, what the doctor might do. He or she may x-ray the lower part of the back and carry out a blood test to confirm the diagnosis. It can be diagnosed with a blood test. Now, what is in the blood to be found that something which gradually over years makes the vertebrae and the spine grow together? is it maybe the entrance door to find a cure? I'm sure they have many people before we thought about it. So what are we doing? They are getting an X-ray of the lower back, and they carry out blood tests to confirm the diagnosis of ankylosing spondylitis. If a diagnosis is confirmed, refer to hospital as usual. So the people are sent on. Where are we going? We are going to a doctor, and when we refer to a hospital, where are we? If the pain persists despite treatment with drugs and the condition is getting worse, then radiotherapy might be tried. I skipped one. But let's continue. Okay, there can be treatment with drugs, but the condition can nevertheless go worse. Do the drugs work? And radiotherapy can be made. In early cases, the results are excellent, with the disease process being apparently arrested. I didn't know ankylosing spondylitis would be stoppable from progressing. More advanced cases with fixed deformity can also benefit from radiotherapy. Okay, and the one here was also, physiotherapy will also be arranged to strengthen the spinal muscles and mobilize the joints. Physiotherapy will also be arranged, I don't understand the sense. Physiotherapy will also be arranged to strengthen the spinal muscles and mobilize the joints. Okay, the people are doing exercises to strengthen the muscles at the spine and to mobilize the joint. This is why I want to mention so strongly that the next stretching we want to do in 2 minutes has nothing to do with what we're reading it. Not all specialists favor radiotherapy because it involves a risk of leukemia in about 3 cases in 1,000. 3 cases in 1,000. Now, which is actually pretty low, 3 in 1,000. That means the radiotherapy is either without much benefit. So, otherwise, the benefits would clearly outweigh the risk of 3 to 1,000. Yes, I think that's the conclusion. Prevention. Where there is a family history of a disease, tests can assist in early diagnosis, allowing early active treatment. That is, again, interesting. So again, a disease which, if it is early detected, and I didn't know that ankylosing at all would be in any way, that something could be helped. The earlier the better. And if people have it running in the family, we might consult even earlier, make blood tests and check with an X-ray if people have it, so that they can get drugs to stop it from progressing. Outlook. For cases which are treated by anti-inflammatory drugs and radiotherapy in the early stages, the outlook is good. For cases in the more advanced stage, the combination of these measures can often restore the patient to a reasonable level of activity. I didn't know it was in any way at all treatable. But it seems to be. Now, that was the ankylosing spondylitis medical part. If you were here for medicine, you can go directly to the next part of medicine. And again, this was no medical advice. You can go directly to the next part of medicine. If you stay and participate in the next session, this has nothing to do with what we read just, which we're doing it anyway, then you can participate. But if you do so, it is at your own risk. We're having, what are we doing? We're having the next shot of point one, and we're doing the Hydro Tower. We're breathing in, lifting the arms up, and we're reaching the fingertips as far as we can to the sides. Breathe in and reach as high up as you can with the fingertips. Again down and reach as far to the sides as you can with the fingertips. And another time, breathe in, reach as far as you can with the fingertips. And again down, reach as far as you can with the fingertips. And now, we circle on the back. Reach as far in front as you can with the fingertips. High up. Reach as far back as you can with the fingertips. Not just to the side but also back and down as far as you can. And another one. Reach as far in front as you can with the fingertip. High up. Not just to the side but also back. Reach as far as you can. And down. Now the pose up. Have the feet standing together. The arms up to the T. And pretend to fly around. And in the other direction. And that was the pose up. Now to the next exercise. Have your legs standing good and stable, the shoulders wide apart, be torn up, shoulders back, breathe in. And breathe out, bring the head over to one side, only as far as it goes, just comfortable. Then breathe again in. And out and bring the chin down onto the clavicle. Breathe again in, lift the gaze and turn the head over to the other side. Don't force anything, just as far as it goes. Breathe again in. And out the head, down onto the clavicle. Breathe again in, lift the gaze and turn it again over to the other side. Breathe again in. And now breathe halfway out and then circle the head over to the other side. Breathe again in. And out and halfway out and circle it over to the other side. And back into the middle. Now we have hands together and the elbows together. Now breathe in and reach up. And out again down. Again in and up. And out and down. And next exercise, hands back, breathe in. And out, reach in front and bring your head down. In and back. And out and in front. Again, in and back. And last time in front. In, back. And down. And now the cashew. Have the feet same together. Intertwine the fingers behind the back. Towel up, shoulders back, breathe in. And breathe out to bring the head over to one side. Only as far as it goes. And the chin down to the clavicle. Breathe again in. And out, pull the hands down to the ground. Again, in, lift the gaze. And now turn it over to the other side. Only as far as it goes. Shoulders back, towel up, breathe in. Bring your chin down onto the clavicle. Breathe out and pull the hands down to the ground. Breathe and lift the gaze and turn it back into the middle. And now stretch your Venus. Have the next centimeter on shoulder width apart. Intertwine the fingers again behind the back, but now bring it over to one side. Tall up, shoulders back, breathe in. And out, turn the head over to the side with the hands up. And then the chin down onto the clavicle. And pull the arm and the shoulder down. While you breathe. Breathe and lift the gaze and turn the head over to the other side. Hands over to the other side. Breathe again in, shoulders back. And out, chin down onto the clavicle. Breathe out, pull the arm and the shoulder down. Breathe and lift the gaze and turn the head back into the middle. Have the feet same together. One arm behind the back. Breathe and lift the arm up. Tall up. And breathe out, bring the head over. Don't pull at the head, just bring it over. Breathe again in. And out, look up to the hand on top of the head. And the hand down. Other hand behind the back. Breathe and lift the hand up. And bring the head over. Don't pull, just bring it over. Breathe again in. And out, look up to the hand on top. And down. Now have the feet standing still together. Breathe and lift the arms up. And we're doing the Markhor. Breathe out, go back, draw the shoulder pads together. Breathe and lift the arms up over across the intertwine the fingers, breathe and reach high. And breathe out, reach in front, hold the back. In and up. Out, lean back. Draw the shoulder pads together. In and up, intertwine the fingers again, the up and around if you're able to. Breathe and reach high. And breathe out, reaching from all the way back. In and up. And out and back. Draw the shoulder blades together. Again up. Over across the arms and reach high, screw. And out and down. Over across the other way around. Breathe in, reach high. Out and down. Lean back with long arms with sky hugger. In and up the middle. And out and lean back. In and up. And out the arms down. And now the eagle's wings. Breathe in, lift the arms up. Breathe out the arms down. In and up again. Out and down. In and up. Bring the hands to touch and lower the hands down to heart center. That was the next stretching. I thank you very much and until next time.